You might as well stand up, Todd, because you folks are fixing to be first on the next one. Here's the question, and this comes from a local county commissioner. This new congressional district includes 9 counties that border Mississippi. All these counties suffer from inadequate emergency health care. In fact, most rural emergency facilities have closed. Federal regulations makes health care a state-based issue. Washington has made dollars available to states for rural health care, but this doesn't fix the current problem. The inability of border counties to share emergency care and ambulance services across state lines prevents these counties from securing federal funding to provide essential emergency care. McNairy County spent 8 years working with 2 states, multiple insurance companies, and healthcare providers, and is finally getting it done, but it shouldn't take 8 years to negotiate the ability of health care for rural American communities. What is your plan to fix this situation?
Well, healthcare is definitely not one of my, I guess you would say, fortes, but one of the first things I think we got to do, Archie, is I think we've got to have competition. We've got to allow these companies to cross state lines. The next thing we got to do, make sure we do, is we secure our Social Security. We've got to stop borrowing from our Social Security and make sure that that's in place for years to come, for the people that's paying now that it might not be here. But I think the biggest thing we can do is try to keep government out of it as much as we can, and we got to open up the competition to go across state lines and help these rural counties in that such matter.
Ms. Charlotte?
Thank you for that question. You know, health care is extremely important to each and every one of us, including our children. I think it's imperative for the government to get out of the way, first of all. And it is imperative that people are allowed to have not only health care, but not have to be concerned about health insurance, which there is a difference in the two. I believe in health saving accounts. I believe that rural hospitals need to be built and be in the various counties. I want to talk with people in leadership who would like to sit down with me and discuss specifically what your needs are in your particular county so we can get this done and address your concern. Your concerns are my concerns, and they are worth looking at, resolving, and coming up with solutions. We cannot answer all of the nuances pertaining to health care right now, but we can make you aware, or I can, that I'm here for you. I'm concerned about health care. I'm concerned about life, concerned about liberty. I'm concerned about the pursuit of happiness, and that's what each and every one of you deserve here. Thank you.
We just go this. They're standing up. We'll stay sitting down, I guess. All right. So my perspective on healthcare and what's going on with insurance is probably uniquely different. What I've watched in my home county of Lincoln, and I'm sure you're experiencing it too, is the hospitals and ambulance services are systematically losing their ability to stay relevant and funded. Why is that? We were in crisis leading into 2008, but when Barack Obama got elected and moved us into an expedited system of socialized health care, we fundamentally lost our ability to stay relevant and competitive in a free market system. So what we're watching now is everybody struggling to keep their head above water in the public and private sector. What I think government needs to do is get out of the people's business. We have to start deregulating, but we can't talk about it anymore. We have to be about it. When we start talking about deregulating and getting back to a system that promotes free market competition, what we have to do is get out in front of it more aggressively than we are. I think Trump 1 had a 2-for-1 proposal on all federal agencies, that if you proposed a new rule or regulation, you had to turn in 2. Now he has proposed a 10-for-1 program that got implemented in 2025. I would argue that it probably needs to be 20 to 25 to 1. But whoever you send to Congress has to be out in front of that conversation and get government back under control and accountable to the people. Thank you.
Thank you. A couple of things. First, I want to say that as your congressman, I'm going to work to ensure that ambulances will be able to go to the nearest hospital, which in this case happens to be Magnolia Health down in Corinth. They're only about 15 miles away. I've dealt with this at the local issue. When I was on the county commission and local government, we had the exact same issue, and I carried the legislation at the local level that allowed ambulance services to be able to transport people from within one city into another city to get to the hospital. I've already done that. I did that 20 years ago when I was in local government. The other thing that I think it's important is that we need to make sure that the emergency room that's being built now, that it has the resources that it needs to be successful, along with Lifespan, which is right across the highway. As you know, there's a helipad that is being built, and Mayor Smith, and by the way, to be mayor in McNairy County, you gotta have the name Smith. I see my friend Mike Smith, former mayor of McNairy County, and John Smith, mayor of Selmer, and Larry Smith, mayor of McNairy County now. I have toured that facility, and the helipad is needed, and there were $215,000 in federal resources that were needed. As your congressman, I would make sure that those resources are available for that helipad for your healthcare needs here in McNairy County.